National Association of Resident Doctors (NARD) has suspended its 5-day nationwide warning strike. National President of the association, Dr. Emeka Orji, said that work resumes at all federal and state teaching hospitals, as well as other hospitals where resident doctors are trained. The doctors, under the auspices of the National Association of Resident Doctors, began a 5-day warning strike in public health facilities across the Federation last Wednesday. Some of the demands of the doctors include immediate massive recruitment of clinical staff in the hospitals and abolishment of the bureaucratic limitations to the immediate replacement of doctors and nurses who leave the system, among other issues. Joining us now is the first Vice President of the National Association of Resident Doctors, Dr. Nnamdi Nd-Ezuma, and he will be discussing the deal between the union and the federal government that led to the calling off of the doctors' warning strike and how to minimize industrial strike in the health sector. Good afternoon and welcome to Newsday.
Good afternoon. Thank you for having me.
Now, Doctor, what more can you tell us about NARD's decision to call off its warning strike? What agreement did you reach with the federal government?
Okay. You'll recall that we commenced the strike on the 17th of May, a 5-day strike. And on the 19th of May, the federal government brokered a meeting between the resident doctors and all relevant stakeholders. In that meeting, all our demands that were listed out in the ultimatum were outlined, and they were discussed at length. Just as you had said, we had major issues that needed immediate attention. For example, the one-on-one replacement or recruitment of medical doctors, considering the long bureaucratic process when you try to replace those that have left the workforce. And considering the fact we're talking about brain drain, this was an issue that was pertinent and needed to be discussed. So, as I said, all stakeholders, relevant stakeholders were present in the meeting, and then timelines and actions were given. Now, the thing is that, most of these things have processes for them to go through, but we were able to put them in specific timelines, and we were expecting that at the end of those said timelines, we should see the desired result from the management, from the government. So we addressed almost all the issues that were listed out in the ultimatum, though some of them have recurred. Some of them are issues that have even, were recurring from 2014, 2016, 2017, So most of these issues came back to the fore again. And as I said, timelines were given, those that were meant to be achieved immediately, those that had short-term and long-term, all those were outlined, and we are hoping that those timelines will be adhered to strictly by the federal government.
Well, we are hopeful, but I do know that we've seen this scenario time and time again. Doctors call off their strike only to pick it up at a later date. So I'm just wondering if you can give us any assurance, or if the federal government was able to give you any assurance, that this time around positive results will be achieved, especially considering the fact that this administration winds down and leaves office, in few days.
Well, as regards, you're very right. We've seen this occurring time and time again. And that's why these timelines are also given in such a way that the resident doctors will still meet. We're hoping to meet at our May OGM from 28th of May to about 2nd of June. And what we expect to do at that OGM is to assess all the decisions, all listed items on the ultimatum, assess them and assess how far we have come in terms of what have been done between now and then. So those are the factors that will determine what our next action will be. As you said, this has happened a couple of times before. So it's dependent on what we are able to see the federal government do between now and that time. That will determine what actions will be taken by the Nigerian Association of Resident Doctors.
But I'm a bit curious about the timing of your warning strike. This administration is already on its way out. What more were you hoping that they can achieve? Why didn't you wait, to take up your issues with the incoming administration?
Well, if you recall, the at the emergency NEC meeting that we had, what our members were calling for was for an indefinite strike. The National Officers Council were able to, calm members down, and that was why a 5-day strike was given. What was actually intended was an indefinite strike. And the reason for this, for the 5-day warning strike, is also to give the incoming government time to be able to see that there is a problem in the health sector, and this must be addressed immediately upon resumption into office. So when we say what we were hoping to achieve, it was more like prepping the incoming government about what it's on ground, the problems, the health-related problems that are really bedeviling the nation at this point in time. And we have, in the wisdom of the NOC, they were able to give this time frame and then decide after which, after the May OGM, take a decision as to what would happen next. So there is never a perfect time for a strike. It is the situation of the country, it's the way the national executive members felt at that point in time, and we should address that issue so that such things do not occur again in the nearest future.
Now, what about the withdrawal of the anti-brain drain bill from the National Assembly? Is that an issue that NAD is also, asking the federal government to intervene in? And in that situation, how do we prevent, further brain drain? How do we prevent further doctors from leaving the country?
All right. So as regards the bill, it was discussed, and the Nigerian Association of Resident Doctors were made to understand that you can't actually stop a member from making a private bill. But, there are processes to having this bill. There are processes through which this bill will be passed, would flow before it is passed. And we were made to understand and given some level of assurance that those processes will be adhered to. And all laws and all restrictions and all the proper laws would actually be followed for this bill if it's actually right for it to be passed. So if there are loopholes in that law or in that bill, then you can be rest assured that it's not going to be passed. We are given the assurance, even at the House of the Senate, that those processes will be followed. And if in any way this bill is not favorable to Nigerians or is in any way against international labor laws, it will not see the light of the day. But outside that, when you talk about how do we prevent the brain drain from continuing, we have said this times and time again, that we have done researches and found out that the major problem why people are leaving the country is because of the remunerations. So we have come up with different, in fact, even at the level of the Ministry of Health, we've had committees that have been set up to discuss issues on what to do about this brain drain. And some of these things are those things that were outlined in the ultimatum. And we hope that the time frame we have given and those committees that have been set will be able to come up with things that could help the government so that we can reduce this brain drain, because it's really telling on the side of the doctors and also on the side of the patients too.
Now, I'm wondering how this dialogue or this mini agreement that you have with the federal government will trickle down to the state, because there are reports that during the meeting, a memorandum of understanding was signed, showing that both parties agreed that the federal government cannot compel states to effect payment of salaries and allowances in the health sectors. So I'm wondering what happens to doctors in state hospitals if perchance, the federal government actually lives up to its own part of the bargain?
Well, the first thing is NAD is an association that comprises of both the states and the federal government. And we work under the maxim of, an injury to one is actually an injury to all. Now, we know that some states might not be able to have the capacity to make some of these changes. But if a state intends to turn out resident doctors or specialists in medical fields, then some of these things are things that have to be taken into consideration. Some of these things are things that have to be done. So it might not be immediately, because, we have some states that have already kick-started. Some states have started the medical residency training fund. Some have even started the hazard allowance. We're talking about simple things like the hazard allowance. And you can't still imagine that at this level, some states are still paying the 5,000 naira hazard allowance for medical for doctors, and they still perform the same services, they still see the same patients. There's no difference between the kind of patients that come to the state hospitals and then come to the federal hospitals. So it's expected that once these things are outlined and said, we know that, as I said, some states might not be able to run the whole stretch, but we would engage and continue to discuss with these states, because you can't still leave them at that level. You can't leave people working at the same capacity and still expect to pay them less. So the resident doctor still stands on the fact that they would always fight for the states, and also fight of whatever they gain at the federal level should also be applied at the state level.
Now, Doctor, I'd like you to tell us a bit more about your demands, and also what realistic, workable steps that both parties agreed upon, in resolving these issues, especially as regards hiring more doctors.
Okay, so as regards the one-on-one replacement, we have said that the bureaucratic process in replacement of doctors that leave the system sometimes takes as much as 6 to 8 months. So within that period, you leave people doing the work of maybe 3 or 4 people in a clinic. So one of the agreements that came up was to find a modality in which there is going to be a one-on-one replacement. And this should be done in less than 3 months. So within the time frame when the doctor or the health worker puts up his resignation letter, the processes of replacement for that particular doctor, so if it's a doctor that is leaving or it's a nurse that is leaving, there will be a replacement for that particular personnel to come into the hospital to replace the workforce in that at that point. So what the modalities about this agreement was to see how the Ministry of Health, the Office of the Civil Service, the Ministry of Labor could work together so that this replacement can be seamless. This replacement can, will not take so much time, so that it doesn't take its toll on the doctors available. And we had put some timelines to some of this. For some of this, there are meetings that are going to take place this week. There are letters that should come out between now and the first week of June. And those are steps we have put to make sure that these things, we see progress, we see the efforts being put in trying to achieve these things. So these are some of the things that would be assessed when we meet at our May OGM, and be sure that these meetings have held, these steps have been taken, so that at least that gives some level of confidence that we are moving in the right direction.
So what role will the health ministry, or the Minister of Health be playing in all this? Because most times we usually hear about the Minister of Labor and Employment. Is the Ministry of Health involved in these negotiations? Is the Ministry of Health backing the doctors in any way?
Yes, it will interest you to know that in the meeting that was held, all stakeholders, as I said, were present. The Ministry of Health was represented, the Ministry of Labor, Salaries, Income and Wages Commission, the Nigerian Medical Association, the resident doctor. So all stakeholders, and that's what all relevant stakeholders, those that will be involved in these meetings and decision makings, we are all involved. And as we said, it's a memorandum of understanding. They will all sign to partake, and we are hopeful that we see their efforts in this action. So they were involved. They are fully aware of what is going to happen and what should be done in the nearest future.
So finally, just before I let you go, what advice do you have for the incoming administration on how to tackle the myriad of challenges facing the health sector in Nigeria?
For us to become a greater nation, for us to represent what we claim we are in the bigger world, our health sector needs to be properly remunerated. We have done a lot of research, and what we are requesting is that the incoming government should involve the stakeholders, involve the health workers in making these decisions that border around the health sector. Involve the stakeholders, because we know what is happening down there at the grassroots level. We know what are the major problems of the health sector. And if we're involved in the process of this policy making, if we're involved in the process of the decision making, we can kind of improve the health sector drastically. But one thing that still stands is that remuneration, the budgetary allocation, is very important that these things need to be stepped up so that the health sector can actually be better.
Dr. Nd-Ezuma, first Vice President, National Association of Resident Doctors, thank you so much for joining us on Newsday, and here's wishing you all the best.